Welcome to this mini course on OBGYN. My name is Dr. Rebecca Ertl and I work as a fetal medicine specialist. I had the great opportunity to be trained by Professor Nicolaides at the King's College Hospital in London. Obstetric ultrasound has dramatically changed the way we approach pregnancies. It has increased safety for mothers and their children. Ultrasound is one of the reasons why maternal and fetal mortality has dropped. While parents usually see ultrasound as baby watching, the truth is, it offers much more. It is also important to be aware that different priorities are set with respect to when the ultrasound exam is performed. Of course, discussing all this topic is beyond the scope of this course, but I would like to focus on a very important and also emotional topic: the fetal phase. I'm sure you all have seen spectacular 3D images, which are not for diagnostic purposes, but allow the parents to bond. Imaging of the face is also, in a way, a quality criterion for the sonographer. It does take some practice, and you need to have good spatial appreciation. In a human being, the face plays an important role in the recognition of an individual, and of course, parents are also strongly attracted to the face of the fetus. But when is the first time we can see the face? The head can already be seen from 9 weeks of gestation. Here is such an example. And of course, the older the fetus gets, the more detailed the structures will be that you can depict. For us as specialists, it is not only the emotional aspect of the face that we are interested in, but also whether or not abnormalities are present. During this lecture, we will show you how the features of the face change during pregnancy and demonstrate a few common abnormalities. Now, let's take a look at the fetus at 11 weeks. So here we see a fetus in a mid-sagittal view. This is the head, here is the back, and this is the bum. At 11 weeks, we can already see a fetal face. This is the forehead, the nose, and down here we see the chin. Remember, the image is very magnified. The actual size is only this small. Now we are at 14 weeks, and the development of the fetus has rapidly progressed. In this video, we see the head over here. We see a beating heart. That's very reassuring. As we phase through the baby, we can make out hands and feet. We can even say it's a boy. Talking about the face, here we can clearly see the forehead, the nose, the jaw, and the chin. Now it's time to scan a patient in early pregnancy and discover what features of the face we can see. So I placed the transducer parallel to the pubic bone. We tried to find the fetus, which is here. And now I need to rotate to get the image of a CRL, the crown ramp length. The head is on this side and the bum is here. So I enlarge the image. And then I freeze. I set the calipers here using the first trimester application. Start by placing the caliper on the head and the bum. The baby's size is 27.8 millimeters or 2.7 centimeters, and this corresponds to 9 weeks and 4 days of gestation. An important aspect is that we can detect organs, and we try to confirm that they are present at the right place. Let's now see the face during this time of gestation. Now I want to show you how to get the fetal profile. We place the probe and We try to place the midline vertically, and when we are at the level of the eyes, we rotate 90 degrees. Now it's only a matter of sliding and tilting a little bit to get a good profile image. We use the box to increase the image. When we look at the profile, we want to see a nasal bone, a forehead, a skull that's covering the whole brain, and no masses here in the back, and also a chin and a clear neck. Ideally, we see the midbrain. Sometimes we can see the mouth opening and the baby lowers the jaw. Ultrasound has really evolved. And here I want to show you an image that demonstrates the power of this technique. With color flow, you can even see the arteries that supply the brain. Now, the fetus is in the second trimester. Again, you can see a 3D image representation. This is the time where we really look at the anatomy. When we look at the face, we want to make sure that both orbits are present. We pay attention to the profile, the mouth, and look if the upper lip is intact. Here we see the forehead, the nose, the upper lip, the lower lip, and the chin. We even can see the lungs here, the heart, and the liver. This is a perfect profile. Additionally to the profile, we are also interested to see the palate, both eyes, and an intact upper lip, including the nose. The views that I'm showing here are typical views that cut through the palate, visualize the two eyes, and this is a coronal view of the lips and nose. Why is it important to look at the face? It is possible to detect anomalies. But what are some potential anomalies? Here's a list. And of course, we cannot go through all of these pathologies in this course, but we want to give you some examples. Micrognathia. In this image, we see a profile of a fetus at around 22 weeks, and what we can see here is that the chin is not in the same line as nose and upper lip. Micrognathia is a condition where the lower jaw is too small. And now the most common defect, the cleft lip. On the left side, you can see the picture we anticipated before, where we see an intact lip and the nostrils. The image on this side is somewhat different. Here we have the image of two eyes, but here, this is the lower lip, and this is the upper lip. And you see this black continuity, and this shows the cleft. When there's a cleft, the amniotic fluid invades the space. That's why it's black and visible. A cleft lip can either be unilateral or bilateral. And with experience, you can even differentiate between those two. Luckily, the therapy for cleft has dramatically improved, and in some situations, it's not even a cosmetic problem anymore. But now it's time to go to a 22-week scan and see how far the face has developed. An important part of the 22-week scan is to check the anatomy of the baby. First, the fetal head. I want to see the cranium intact. In some cases, the midline is not always as clear because of the acoustic shadowing. And I will freeze at the level of the cavum septum pellucidum and the posterior horn of the lateral ventricle, because I want to see that this should appear as a rectangular box. And the lateral ventricle should not exceed 10 millimeters. I also slide towards the fetal neck slightly to see here the two thalami, and I will rotate the right side of the probe slowly towards the fetal bum. And here, this is the cerebellum, and behind the cerebellum, the black area is the cisterna magna. Next, we want to see the eyes. So how do we get to the eyes? Remember when we talked about the transducer movements? We're sliding and trying to bring the eyes to 12 o'clock. So now the face is looking upwards, so we get to see the eyes. Here is the palate, the roof of the mouth. This is part of the forehead. This as well. So you need to follow the baby. The baby is moving and we need to follow it. So as soon as you have the eyes, you can tilt towards the fetal mouth, and here you have the palate, this white area. And going back to the eyes, we will rotate and obtain a profile. When we look at the profile, we want to see the forehead, the nasal bone, the nose, the upper lip, and the lower lip, and the chin. And we want to see that the proportions are correct, that the chin is at the level of the lips and nose. So the remaining structure we need to see are the lips, the fetal lips. We want to rule out a cleft lip. So coming back to the fetal head, I want to show you a trick how you get to the lips easily. This is the biparietal plane. After some practice, all of us will be able to obtain this image. And then we rotate the back part. We try to stay at the cavum septum pellucidum, but we rotate the back part towards the fetal neck to obtain the cerebellum. But we continue to rotate. And we see here a cranial view of the fetal face. Here we can see the lips, the upper lip, the nostrils, and the lower lip. The mouth is a little bit open, that helps us. And if there was a cleft, amniotic fluid would be filling out the gap. So it's very easy to make out. Here we can see some fingers in front of the fetal face. We can see them moving. By rotating the probe, you can get a better image of the finger. But be aware that the thumb is usually in a different plane, so you do not always get 5 fingers in one plane. And it's always difficult because the hand, as you can see, is moving around. So, now we've seen everything on the fetal face. In the 3rd trimester, we can even see more details. And with modern ultrasound technology, we can even pick up very human behaviors. Here, you can see a baby swallowing. For this baby, the lecture is simply too boring, and it's yawning. And this baby seems to snort. But more important, an even more detailed depiction of the anatomy is possible. And this will allow us to depict even subtle abnormalities. In this fetus, however, we can clearly see that the lips and the nose are okay. To conclude this mini course, let us now give a few impressions of a third trimester scan.
Let's take a look at our model and find out what the position of the baby is.
To do so, we place the transducer parallel to the pubic bone and see what structures are there. So this is clearly the head. Try to obtain an image where the skull is completely in the center of the picture. You want to see the midline, which is here. And since we know that this is the cavum septum pellucidum and it is in the ventral part of the head, we know that this must be the front. So we know just by looking at that picture that the fetal back must be to the maternal left side.
Let's demonstrate this position on our doll.
So we expect the baby to be in this position. We were looking at the biparietal plane of the fetal head, or this doll's head. If we move the probe upwards, we should see the neck, the chest, and further up the bum. Let's see if we can confirm our assumption. So here we see the fetal head, and we stick to the bones since they're so bright. Even in late gestation, they're easily to make out on the screen. Be aware that in late gestation, you do not see a very detailed picture of the fetal brain. A very important landmark is the beating heart. And as soon as you have found that, you can rotate the probe a little bit and slide towards the fetal bum, and just below the heart you usually see a black area, which is the stomach. Moving further down, we get to the fetal bladder. Usually filled in late gestation, it's a big black area, and very close to the bladder you see a white structure. This is part of the femur. When you see this structure, you can rotate on that structure so you get a full image of the fetal femur.
So we know it's getting more difficult towards the end of pregnancy to identify all the structures. Can you give our audience some tips on where to orientate?
We have some landmarks we can hold on to, and what always helps, we look for the bones. The bones are bright and give us a clear structure. So to identify the head, we just look where we find this oval shape. Another landmark is a fetal spine. Since we know this is the back of the fetal head, the spine must be on this side. To find the spine, you rotate 90 degrees, and here you see the spine. So this is the neck, and you can go further down, and when you expect to be at the level of the chest, you can rotate again. Or you use the technique I showed you previously, where you slide towards the fetal bum, perpendicular to the axis of the fetus. So I do hope you got an impression on the potential of OB scanning. And of course, we can examine way more than the face. But this will be discussed in the bachelor class. Daniela and I will be happy to meet you there.